Thank you, sir. I would like to welcome Dr. P.S. Karmakar, consultant physician and medicine at Jikar Medical College and Hospital. He is the organizing secretary. Sir, I would request you to share.
Thank you, Dr. for your nice introduction. Very good evening, distinguished dignitaries and learned audience online. We are here ultimately in inaugural curtain raising program of World Congress on Adult Immunization. It has already been expressed by Dr. Muruganathan before me that this was supposed to be organized in 13th and 14th April 2020, almost 2 years back. But our effort, our hope to organize that conference became shattered by COVID pandemic situations. So here we are again together in a very short form inaugural program for World Congress on Adult Immunization. So we are happy very much to get so many distinguished dignitaries like Dr. Muruganathan, Dr. Sadki, and there are many others, Dr. Eta and many others. So we are really very much thankful to all those distinguished dignitaries for taking some time off to attend our program. And you all know that today is our inaugural program, and we are going to make this event in a bigger way, in a mega event that is in the last week of April of 2022. So I'm really thankful to all the dignitaries as well as the learned guardians who have joined online to make this program a grand success. Good evening and thankful to you all. Now I hand over the digital podium to Dr. Devdatta for the next proceeding. Thank you very much.
Thank you, sir. So I would like to proceed on with our sessions. The very first session is on adult immunization, a global perspective by Dr. Reda Sarki, and the session will be chaired by Dr. Shatabdi Mitra. She is a very known face to us. She is currently working as the assistant professor cum epidemiologist in the Department of Community Medicine of KPC Medical College and Hospital. She has a wide experience of teaching, training, research, and practical services. She is a national level trainer of non-communicable diseases, immunization and leprosy, and state level trainer in geriatric health and mental health. She has published more than 14 research articles in different national and international journals with more than 250 citations and working as reviewer of different journals. Dr. Shatabdi is also working for medical education, and she is an active member of Medical Education Unit and Medical Education Society of India, besides IPHA and IAPSM. She has completed fellowship in vector-borne diseases from London School of Hygiene and Public Health in 2019. She has presented papers in different national and international conferences and was awarded with Ford Foundation for research proposal. Currently, she is working with geriatric mental health, diabetes-related complications, and non-communicable diseases. I would like Dr. Shatabdi Mitra to take over the session. Thank you.
Thank you, Dr. Devdatta, for the nice introduction for me. In this session, I am here to be privileged to have Dr. Reda Sarki. I am going to introduce her. Dr. Reda Sarki is chief executive with lifelong experience in forging multidisciplinary terms to invent and execute new ways to lead change. He is the founder and president of the prestigious Geneva Learning Foundation and chief learning officer of Learning Strategies International. REDA has worked for the United States, United Nations, primarily for the World Health Organizations and at the International Federation of Red Cross and Red Crescent Societies. Over a decade ago, he partnered with the global learning leaders to explore how to transform digital learning for the Red Cross and Red Crescents. 13 million volunteers and 5 lakh staff over 190 countries. Starting in 2016, REDA led the development of what had become, by January 2019, the world's largest and fastest growing digital health network of immunization professionals. When the COVID-19 pandemic hit, this digital health infrastructure enabled the development of the COVID-19 PR Hub to support rapid response and collaboration across the health system levels and borders by professionals to mitigate the shock of the pandemic on immunization services, to respond to the root causes of vaccine hesitancy, and to strengthen the resilience for the service recovery. REDA's vision today is that the COVID-19 pandemic has created an opportunity for a digital-first renaissance in global health. He believes that the next 20 years of public health are likely to be about harnessing the digital transformation through hybrid networks, fusing digital and physical in ways that can help not only deliver knowledge, not only deliver health, but actually transform health outcomes. Learning how to develop people by digital means is a vital investment for the promise of digital health to be realized. So let's get enlightened ourselves and all the participants from Dr. Reda. Sir, please.
Thank you very much, Dr. Mitra, distinguished speakers and leaders of immunization in India and everywhere else, given this is a World Congress on Adult Immunization. I'm going to go perhaps very quickly, and this presentation may not look like a conventional presentation suitable for a World Congress. Some of you may even be surprised, or I hope not offended, but and one of the ways in which it is going to be different is that you'll be hearing music and perhaps other sounds as we go. So first of all, I'd like to say this is very timely. I think there's a small technical glitch, as always happens, of course. This is very timely because Immunization Agenda 2030, so the strategy adopted by all of the member states of the World Health Organization, as you know, places as one of the key strategic priority for life course and integration, with the goal that all people benefit from recommended immunizations throughout the life course, effectively integrated with other essential services. However, the story I'm going to tell you will show that it's not so easy. And in fact, recently I had a chat with someone from the headquarters of the World Health Organization, one of the people responsible at the global level for life course and integration, who said, what can we do to get more interest from professionals who work in immunization in this question? So that is one of the ways, one of the questions that I'll be trying to answer. Now, our work since the 29th of April, so World Immunization Week 2021, has focused on this question, really thinking about the future of immunization. And at least for this decade, it's focused on Immunization Agenda 2030. Now, just if you can easily, if you don't get everything you want from this presentation, if you'd like to know more, just look up the Geneva Learning Foundation or my name, and I welcome, happy to connect with you and encourage you to connect with the foundation. Another thing is, one of the things we're experimenting with, and this is part of our mission to find new ways to learn and lead, is really to, we're now offering a podcast, and I encourage you to go look at that if you'd like to know more about our work. Now, very brief introduction to the foundation's work. We develop a number of programs. It's about transforming how we learn and lead. The basic change in the model is shifting from old learning, where you have a teacher at the center addressing the students, transmitting information to the students, going to a new learning model in which teachers are learners and learners are teachers, connected to each other around this hub and spokes where everyone is connecting with everyone else. Here at the right, you see one of the main theoretical models and frameworks that we rely on from Bill Cope and Mary Colensis, which is really an agenda for new learning and assessment. What that means in practice, for example, in our partnership with the World Health Organization, we've developed already, I think to this day, we're now at the 30th. We're currently running the 30th cohort. The last 4 or 5 cohorts have been specifically on Immunization Agenda 2030. And one course in particular really helped immunization professionals look at this question of life course and integration. Now, with the first evaluation in January 2019, this is what we found. These are more than just courses. These are interventions designed to foster and improve practice at every level. Together with, in fact, Dr. Mitra, other scholars from India and 56 other countries, we then built what we call the Impact Accelerator, a new kind of system to help immunization professionals tackle difficult questions and lead change, including this change from where we are now with vaccination focused primarily on small children to a more complex but also more valuable and more productive immunization system that looks at immunization all along the life course. We found that this system, for example, within 6 months could produce startling results where we saw that people who engaged through this impact accelerator were in fact able to lead change far more quickly, with almost an 8x difference. We're 8 times more likely to actually develop a meaningful, tangible project around their needs, their challenges at the local level, wherever they work, and actually take that project forward. So where we are today is, as of this morning, our platform connects 43,981 immunization professionals. And again, in this decentralized model, it is not only about what we, as the Geneva Learning Foundation, transmit to practitioners, it is also very much about practitioners sharing with each other. On the 29th of April 2021, you can see here the 2 top global people from UNICEF and WHO respectively, Dr. Robert Nandi and Dr. Anne Lindstrand, who met with over